Good afternoon. My name is Melissa Gilmore, and I am in the uh, public health course number 5080, and my project is on isolation and mental health, COVID-19. I first like to start off talking about the general general model generalization model public health, and that is assessing needs, setting goals and objectives, developing intervention, and implementing the intervention. The generalized model for planning for this project will be focused on the rationale for specialized program, the impact of COVID-19, shelter in place, which is a contributing factor to the lack of social contact with others, which can lead to other issues dealing with mental health, such as depression, anxiety, and loneliness. The targeted group is the older population, and the goal is to get the awareness out about anxiety and depression and explore better solutions to stay in contact while social distancing. Mental health issues, there are other mental health issues such as major depression, schizophrenia, obsessive compulsive disorder, and panic disorders, to name a few. Concerns for the older adults are the ones that are living in nursing homes and assisted living facilities which have restrictions. And when I say older adults, we're talking about the population of 70 or older. And this is also, I can reference this also to me working in the hospital, and I have to monitor COVID patients. So I'm very familiar with the isolation process, and it's not very pretty. We try to find ways to keep the patient occupied and not to fall into that gap of depression, loneliness, and anxiety. Normally, the patients in the hospital that I work with that suffer like from anxiety and depression, they usually give them the drug Ativan if it gets too out of hand to deal with the anxiety. Also, the staff tries other means of communication, such as the telephone, the landline, there's the cell phone, and then there's the internet. And usually the internet is a big hit because we have social media sites such as Zoom, Facebook, Instagram, Snapchat, Twitter. These are all ideas, to stay in contact with your loved ones and friends and family, to combat the loneliness and not being able to socialize in person, which is a big, huge factor in the COVID-19 pandemic. And an example of that is like Veterans Affairs. They have stepped up the plate to donate like tablets to help patients combat the isolation. So that's one tool that is used to kind of help patients out with that. But just an overall general, to identify the practice to keep socialization open. And again, I said there's other, avenues without physical contact, such as telephone, landline, cell phone, Facebook, Instagram, Zoom, Snapchat, just to name a few. And one thing that's popular with the doctors is the telehealth, where you connect to the doctors via computer, using Zoom, things such as mail delivery for medications and health supplies. That's a big help to make sure that the older population gets the medication and supplies they need. The determinants to calm fears about isolation. Isolation basically is due to stop the spread of COVID. It is not meant to keep you away from your family and friends. That's not the intent. But like I said, with the numbers going up, there are other avenues that you could use to stay in contact, with your loved ones. And, just to get the word out about isolation by mail or by networking through the internet. And, the internet we see sometimes as a negative light, but since the pandemic has come into play, it's been in a good light because it keeps us in contact with, with family, friends, loved ones, a business tool. COVID-19 cases have COVID-19 cases are over 50 million in the United States, and 800,000 deaths have been accounted for through that. From August of 2020 to December 2021, 3,553,483,000 people have been affected by hospital admissions with COVID. From December the 4th to December the 17th of 2021, the average patient per day with COVID is roughly 7,800. And this data is for patients that are targeted by COVID, which are 70 and over. The theory-based message is to target the older population, 70 and older, to make them aware of COVID and doing COVID practices such as social distancing, wearing your mask, getting the vaccine if where be permitted, if you can, without any complications or whatever the case may be. Isolation mandates, that can lead to anxiety and depression. And lastly, to be an inspiration through mail, computer, and social distancing techniques. The goal is to use the formative evaluation approach to target the audience for the best health belief model to combat anxiety, loneliness, and depression. The COVID-19 crisis, social and economic implications, promoting physical distancing while maintaining social isolation, implementing best practices for the population to stay socially connected, and promoting health awareness. Okay, thank you.